We're going to cover the palpation route for the hip. We'll start with the anterior superior iliac spine. Then we locate the Sartorius, which attaches from there and goes down. And we've got the tensor fasciae latae, so we're going to locate the bony prominence, come to the side, that's your tensor fasciae latae. Again, locate your bony prominence. Then the iliac crest would be going up and round. So this is the iliac crest. Then again, we locate the bony prominence. And for the Psoas Major, we go across and in. And the iliacus, again the bony prominence, tuck yourself in just behind there. Pubic tubercles, we get our client to locate their tummy button and slide their fingers down until they locate two bony prominences. We place our fingers over the top, slide your fingers away, and then we can locate it. Okay, then we have the Iliofemoral Ligament, just in here, Iliofemoral Ligament, and the Femoral Nerve, so locate, we go back up here, and then we've got the Femoral Nerve. This will reproduce the symptoms. The greater Trochanter, so then we come to the side, and then it'll be this area just here. And then the labrum, not palpable, but this will be in this area here, the head of the femur. Then we have the Iliopsoas bursa, so that would be in this area here. So the Iliopsoas bursa, maybe a lump. Okay, now if you could turn over onto your front, please. Right then, so we've got the glute max. We've also got the glute medius. We've got the Quadratus Lumborum coming up here in this area. We've also got the PSIS, so just on that here. And we've got the Ischial Joint coming in here. We've got the Ischial Tuberosity coming in here. Ischial Tuberosity. We've got the Ischiofemoral Ligament, so just in here. The Trochanteric Bursae, which is just on the side here. And then the Ischial Bursae, which will be just in here, Ischial Bursae. And that concludes the palpation route for the hip.